forward to welcoming you to our hospital's international courses.
We are delighted to launch the first international educational program series at Imam Reza General Hospital, Tabriz, Iran.
Tabriz is a historical and vibrant city.
You will love our beloved city.
Join us for our educational programs.
We'd love to have you here.
Waiting for nice days together.
See you soon!
Hello everybody, I'm very happy to see you again, and I'm very honored to host one of the other guests talking about the clinical courses, short courses in Imam Reza Hospital. I'm very honored to host Dr. Haleh Rezaee from Department of Clinical Pharmacy. Thank you, Dr. Haleh Rezaee, to accept our invitation. And I'm really happy to host you today. First of all, I would like to ask you to introduce yourself, your educational background, field of activity, and then we will go ahead with more details about the course.
Hello, Dr. Imamzadeh. Thank you for inviting me, and it's my pleasure to be here as your guest. And thank you for giving this opportunity to me and my colleagues in Department of Clinical Pharmacy to be here and present our activities and educational program.
Our pleasure.
I'm Haleh Rezaee. I'm Associate Professor of Clinical Pharmacy. I'm an academic member of Tabriz Medical Sciences University. I completed my PharmD degree in 2006 in Tabriz University of Medical Sciences. And I graduated from Shahid Beheshti University of Medical Sciences in Tehran in 2012 as a board-certified pharmacotherapy specialist. And since 2012 until now, I'm an academic member of Department of Clinical Pharmacy in Faculty of Pharmacy in Tabriz University of Medical Sciences. I was the head of the Department of Clinical Pharmacy for about 4 years. And also now I'm the head of pharmaceutical care unit in Sina Hospital, and I'm the Sina Hospital's clinical pharmacist. My fields of activity is infectious disease pharmacotherapy, internal medicine, as well as intensive care unit.
Very good, very extensive background, thank you. Before starting to talk about the course you are providing for the audience, I think it's good, it would be good to talk a little bit more about clinical pharmacy. What is clinical pharmacy? What do you exactly do in your daily practice? And if you think it would be helpful to talk a little bit about the history of clinical pharmacy in Iran, establishment, and it would be helpful to start the conversation.
Thank you for complete questions. If I want to define the clinical pharmacy, in 2005, the American College of Clinical Pharmacy, ACCP, defined the clinical pharmacy about, such this manner: the area of pharmacy concerned with science and practice of rational medication use. Clinical pharmacy is a branch of pharmaceutical sciences specialty which pharmacists promote medication, rational medication use, which is safe, cost-effective, and appropriate. About your question, who is clinical pharmacists? Clinical pharmacists are practitioners with advanced education and training. They provide direct patient care and comprehensive medication management in hospitals, both for all patients and healthcare providers such as physicians, nurses, medical students, medical residents. Clinical pharmacists in hospitals focused on monitoring pharmacotherapeutic regimens of the patients and monitor these pharmacotherapeutic regimens. They practice actively and participate actively in patient care, as well as cooperating in educating the staff of the hospital, such as physicians, nurses, and especially education of patients at the discharge time about how they use their medications at the discharge time. When we talk about medication management, it's a significant term which implies and summarizes the important role of the clinical pharmacist in patients' care. It applies issues related to indications, use and administrations, and therapeutic goals of drug use, as well as adverse drug events of the drug interactions, and monitoring parameters of the patient's medication regimen. Clinical pharmacists mostly work in hospital wards, in different hospital wards. They have various other activity, as I mentioned before about their activity in the hospitals. Most of them are academic members at the national universities, and also they work in their own fields of activity. About the background of the clinical pharmacy in Iran, if I want to tell a brief history, clinical pharmacy services started in 1991 in Iran in Tehran University of Medical Sciences by graduated clinical pharmacists from United States universities as a pioneer. And residency program in clinical pharmacy in Iran founded in 1994 in Tehran University of Medical Sciences in Faculty of Pharmacy. And now, around more than 3 decades, we have clinical pharmacy as major academic and health profession has been introduced to pharmacy faculties and healthcare systems of Islamic Republic of Iran. Now, after 30 years, we have more than 250 clinical pharmacists around our country. Most of them are faculty members, and also they work in teaching hospital as a clinical pharmacy in their specific fields of activities.
Very good, very extensive and broad background and explanation. Thank you. What about our own university in Tabriz? What is the background? Please briefly to go ahead with the course you are providing.
Thank you, sir. In Tabriz in 2010, clinical pharmacy services were started for the first time by involvement of a clinical pharmacy specialist who was a specialty in intensive care unit. He was introduced to an ICU center of a main referral university affiliated hospitals, and he established the independent pharmacotherapy round by medical residents and pharmacy interns with these goals that they have therapeutic management of the patients and also educational interventions. Therapeutic and educational interventions.
Very good. And you train also residents in clinical pharmacy in Tabriz?
Yeah. About residency program in Tabriz, it was started in 2018 and we have now about 20 residents. Tabriz University of Medical Sciences has had 5 admission residency programs. We have, as I mentioned, about 20 residents in clinical pharmacy in our department, and also we have had our first pharmacotherapy specialist who is graduated from our department last year.
Very good. Very good. Congratulations.
And I want to add this information that in our department now we have 5 academic members I want to name our academic members, Dr. Hadi Hamishekar, who is the Professor of Clinical Pharmacy and his fields of activities Intensive Care Unit in Imam Reza Hospital. Also, he is the Head of the Pharmaceutical Care Unit of Imam Reza Hospital. Dr. Taher Entezari, who is his fields of activities cardiovascular pharmacotherapy. He works in Shahid Madani Heart Center, and also he is the head of the Department of Clinical Pharmacy of Tabriz University of Medical Sciences, and also he is the head of Pharmaceutical Care Unit of Shahid Madani Heart Center. Dr. Afshin Qarekhani, who is associate professor, and his field of activity is nephrology and transplant, and he works in Imam Reza Hospital. Dr. Elnaz Shaseb, who is assistant professor of clinical pharmacy, and he is the head of pharmaceutical care unit of Az-Zahra Hospital. Her fields of activities obstetrics and gynecology. And finally, myself, as I mentioned before, I'm the head of pharmaceutical care unit of Sina Hospital, and my fields of activity mostly focused on intensive care unit, infectious disease ward, pharmacotherapy, and internal medicine.
Very good. And you, all five of you, are providing the course for the participants.
Yes.
You are all involved in different parts.
Yes, all of our members were involved.
And now let's go to the course itself. What's the name of your course? What is the content? How long you are providing the course? Is it flexible to be shorter or longer based on the needs of participants and other features?
Thank you. Sure. Now we are planning for 1 month's fellowship course of pharmacotherapy in shadowing pattern. We aim to admit pharmacists and hospital pharmacists in this course, that they will be assigned to our department's professors and shadow them in every clinical wards which they practice. The volunteers of this course will participate actively in the morning reports, in the medical rounds, along with our professors and our residents and our pharmacy interns, also with medical students. And they also actively participate in pharmacotherapy consultation process with our professors and our pharmacotherapy residents. And they also actively participate in medication reconciliation process in the hospital, which is, these are the process which is filled for a patient who is admitted in a hospital and receiving more than 5 medications, and the medication reconciliation process forms filled by clinical pharmacists. Volunteers of this course will participate actively in this process along with our professors and residents. They also participate actively in our weekly journal clubs and case series presentation. Case series presentation or CPC sessions will held based on weekly basis, held on weekly basis in our department, and our residents present their special cases with specific condition and very important information regarding the patients present in the sessions, and pharmacotherapeutic interventions will be discussed in these sessions. And reviewing this series can improve our residents' problem solving and therapeutic planning skills of our residents in the hospital. Also, the participant of this course will visit the patients with our professors and residents on a daily basis and will discuss about their related problems and important pharmacotherapeutic points.
Okay, you told us that the course is a 1-month course, and I would like to know if the participant needs to extend the term. Do you recommend, do you confirm that it is possible, or you think the 1-month course is
For
quite...
beginning, we are planning this 1-month course, but for more collaboration, as we are one of the pioneers of clinical pharmacy in Middle East, We are planning for near future to admit postgraduate pharmacists in our residency program. But this course is a 1 month fellowship course of pharmacotherapy.
Okay, and who exactly is eligible for the course? I mean, graduate pharmacists or possibly students in their senior years? I don't know.
Our main, yes, very good question. Our main goals in this course is to admit pharmacists and especially hospital pharmacists, postgraduate pharmacists and hospital pharmacists in this course.
Very good. I think this was a rather informative talk about the clinical pharmacy, although I think that there is many things to say in this regard. If there is anything you want to add at the end of our conversation,
thank you,
Dr.
Dr. Salimzadeh. As I mentioned before, as a pioneer in Middle East in fields of clinical pharmacy, we planned this 1 month fellowship course of pharmacotherapy, and we have implemented this course with the aim that, with our main aim is have this course on the fields of intensive care unit, cardiovascular pharmacotherapy, infectious disease pharmacotherapy, and gynecology and obstetric pharmacotherapy, as well as nephrology and transplant fields. And I want, again, to focus on the clinical pharmacist activities in Iran and Tabriz. Our academic member actively participates in medical rounds, actively participates in pharmacotherapy consultation, modification of drug regimes of the patients in hospitals based on patients' specific conditions such as renal failure, liver disease, shock, obesity, pregnancy and lactation, diabetes, hypertension. They actively participate in preparation of standard treatment guidelines, clinical practice guidelines, and drug treatments guidelines in hospital. They actively participate in calculations of total parenteral nutrition and nutrition support for patients, especially admitted patients. They actively participate in pharmacokinetic process such as TDM, therapeutic drug monitoring. They all calculate the dose needed for patients based on patient's serum level of some specific drugs, such as in transplant patients or in epileptic patients. And finally, they also participate actively in educational process of the hospitals for physicians, medical students, medical residents, our pharmacotherapy residents, and nurses and other staffs of hospitals. And again, thank you for giving this opportunity to me and my colleagues in the Department of Clinical Pharmacy. I presented our activities as behalf of our department, and thank you again for giving this time to our department, and I hope the information we talked about to be useful for our audience.
Sure. Thank you for accepting our invitation, and thank you for watching us from this studio, COVID studio, Imam Reza Hospital. Today again with another talk with Dr. Haleh Rezaee. If you need further information, you can follow us on our website, and you can follow the addresses subtitled below to be in contact with our expert team. And thank you for watching.